The United States has many old problems that need to be addressed. The fact that marijuana is a Schedule I drug still to this day is quite embarrassing. We as a country are moving in the right direction, and I think we'll eventually pass a bill on the federal level that will allow state medical marijuana laws be recognized by the federal government. There are many good medical benefits and issues that can be resolved if the federal government would just legalize this herbal medicine. Firstly, I would like to address how and why the United States is ready for marijuana on a federal level. In an article called Why 2021 Should Prove the Year of Federal Cannabis Legalization, we learned from Lori Kibbe statistics and polling regarding legalization and decriminalization of marijuana. Lori Kibbe is a co-founder and chief financial officer of Kings Garden, California's preeminent cannabis cultivation, processing, distribution, and manufacturing company. More than half of the states in the union have already decriminalized medical marijuana. Some of those states have even legalized recreational use. Already, 35 states and Washington, D.C. regulate the production, sale, and use of marijuana for medical purposes. 15 of those states also allow adult recreational use, according to a national conference on state legislatures. Polling is strong across the United States people regarding marijuana, but the money that states are pulling in speak for themselves. States like California, Colorado, and Washington were some of the pioneers in medical marijuana decriminalization and are doing very well economically with the help of marijuana. The United States marijuana industry is now valued at more than $18 billion. The legal market in California, the nation's largest, reached $4.4 billion in sales, up from $2.8 billion a year earlier. Sales in Colorado topped $2 billion last year, up from $1.7 billion in 2019, while Washington State exceeded $1.4 billion, up from $1.1 billion. There are many studies going on regarding the health benefits of marijuana. Up until recently, many of these studies have not been legal to conduct in the United States. In an article published by WebMD, Medical Marijuana FAQ, many different questions are answered regarding the health benefits of cannabis. Currently, many people use medical marijuana to treat medical conditions like Alzheimer's disease, appetite loss, cancer, epilepsy, glaucoma, nausea, pain, and seizures. Marcel Bon Miller, PhD, who is a substance abuse specialist at the University of Pennsylvania, states, the greatest amount of evidence for the therapeutic effects of cannabis relate to its ability to reduce chronic pain, nausea and vomiting due to chemotherapy, and spasticity, tight or stiff muscles from MS. Marijuana has already had great impacts to communities that have decriminalized it, and not only financially. One article from Healthline.com called Study Finds Lower Opioid Deaths in Counties Where Cannabis is Legal has data that shows lower opioid-related deaths in counties with medical cannabis. Opioids are a possibly dangerous drug used to treat pain. If used improperly, they can lead to death. The study's analysis showed that increasing the number of dispensaries in a county from 1 to 2 was linked to a 17% drop in deaths due to opioids. Chelsea Shover, PhD, is an associate director in the Division of General Internal Medicine and Health Services Research at UCLA School of Medicine, and she says, one of the strengths of the study that the researchers examined the data at a more fine-grained county level. With all the previous information provided, I think we can all agree that the United States is ready to move on from an age-old policy that doesn't really fit in today's society. Not only have I gone over the medical reasons, but also to reduce addictions of opioids and even possibly alcohol. It is time to act, America. It is time to come together and move forward as a people to make sure that we allow this medication be used properly and effectively by the people.